In this presentation, we will be going over the disease malaria. We will be discussing what is malaria, the parasite characteristics, the history of the disease, the symptoms of the disease, the stages of infection, how it's diagnosed, and how malaria is treated, and some preventative measures. We will also discuss some interesting facts. What is malaria? Malaria is a disease caused by Plasmodium parasites. Malaria is transmitted by female Anopheles mosquitoes when people are bitten by them. Anopheles mosquitoes are also known as marsh mosquitoes. They are usually found in tropical climates, especially near bodies of water. On the right, there is a picture showing how the cycle begins and how it keeps getting transmitted from person to person. Number 1, a bite from an infected mosquito transmits malaria. Number 2, the parasites travel to your liver where they lie dormant, usually about 10 to 4 weeks. Parasites leave the liver and infect red blood cells. This is when malaria signs and symptoms typically develop. And number 4, the final stage, is how the malaria is transmitted to an uninfected mosquito is when it bites someone with the disease. The mosquito can then spread malaria to other humans. Malaria parasite characteristics. Malaria parasites change shape throughout their life cycle. The malaria parasite is a protozoan. A protozoan is a single-celled organism. The deadliest malaria parasite is called the P. falciparum. It causes 90% of the world's deaths by malaria. Below is a picture showing the different types of malaria parasites and their changing shapes throughout their life cycle. The history of malaria. Malaria goes back a very long time. The first reference of malaria was in a Chinese document from 2700 BC, clay tablets from Mesopotamia from 2000 BC, Egyptian texts from 1570 BC, and Hindu texts from the 6th century BC. The discovery of the parasites in the blood of malaria patients was first discovered by Alphonse Lebrun in 1880. It actually used to be thought that malaria was caused by vapors rising from swamps, but it is now known not to be the cause. Malaria also means bad air in Italian. The most malaria cases happen in sub-Saharan Africa, but there are cases around the world, millions of cases globally every year. Symptoms of malaria. Symptoms of malaria include fever, chills, headache, nausea and vomiting, diarrhea, abdominal pain, muscle or joint pain, fatigue, rapid breathing, rapid heart rate, and cough. As you can see, it mimics other communicable diseases, making diagnosis very important. The time it takes to make you sick varies by species of the parasite once infected. The shortest time is 8 days, the longest time is 40 days. The cycle first begins when the female mosquito adjusts the sexual reproductive cells of the parasite during a blood meal. They are then fertilized in the mosquito's gut. On the right is the life cycle of the malaria parasite. When they are fertilized in the mosquito's gut, they become gametes, and then they mature, and the mosquito injects the parasite when it bites the human. The stages of infection. The cells malaria infects are liver cells and red blood cells once invaded by the parasite. The first stage of the infection is the entrance of the sporozoites and mosquito saliva into the skin and bloodstream of the human host. Sporozoites are the infective stage of the malaria parasite. The parasites then emerge from infected liver red blood cells. They then invade new red blood cells and multiply inside them, causing the symptoms of malaria. This is a picture depicting the stages of infection. First, the Plasmodium sporozoites infect the liver and hide out there. And they multiply asexually. And then they burst out, releasing plasmodium cells called merozoites that infect red blood cells. The merozoites then reproduce asexually inside the red blood cells, and they cause a lot of destruction of the red blood cells as well as a changing of the shape of the red blood cells. How is malaria diagnosed? Malaria is identified by looking at slides under a microscope. This is done by examination of stained blood films using Giemsa, Wrights, or field stains. A patient's finger is cleaned with alcohol, dried, then the side of the fingertip is pricked with a lancet and 2 drops of blood are placed on the slide. Below is a picture of what the parasites look like under a microscope. Malaria treatment. An estimated 247 million cases and 619,000 deaths occurred globally in 2021 due to malaria. The first anti-malarial drug was quinine. Quinine comes from the bitter bark of a tree native to South America. Quinine and other anti-malarial drugs disrupt the schizon stage of the parasites. This is the stage in which the cells mature and multiply. In 1820, the French chemists Joseph Pelletier and Jean-Benem Caventou isolated quinine from citrona bark. A vaccine called RTS-SAS0 is a vaccine that is currently being recommended to children in places around the world with high transmission of malaria. Malaria prevention. One preventative strategy against malaria is insecticide-treated nets. You place the net over your bed so that the mosquitoes can't reach you while you're sleeping, and the insecticide kills the mosquitoes. Some other preventative strategies are wearing clothes that cover your entire body, spraying insecticide around your home, removing stagnant water sources, and taking precautions before traveling. Malaria interesting facts. It has been found that blood group O has been associated with less severe malaria cases. And also, scientists are now able to grow the erythrocytic stages of malaria parasites. The erythrocytic stage is when the parasites multiply within red blood cells. This allows them to test the effects of drugs directly and allows the potential for more vaccine and chemotherapy research.